Good evening, respected seniors, my colleagues, and dear student friends. I, on behalf of PG Abdesan subspecialty of Indian Psychiatric Society, all to our weekly webinar series, Upskill. As you all know, in this weekly academic series, we intend to discuss various topics which are often missed during our PG training. But these are really important and are necessary for the upliftment of the skills. Hence, we call it as upskill. You can gather knowledge, enhance your skill, and clarify your doubts in this program. Also, you can win exciting prizes by asking questions, because every week we have got a prize for the person who has asked the question and which is just to be the best by the speakers. Before proceeding into today's proceedings, it's time to announce the name of the past week's winner. It's Sina Shah from Institute of Mental Health and Neurosciences, Kashmir, Srinagar. Congratulations, Isa. And you will be receiving this e-certificate as well as a book, a primer of research publication and presentation. This is the official publication of Indian Psychiatric Society. The editors being Sandeep Grover and our own chairperson, Sahul Amin. Isa, if you are here, kindly send your email ID as well as your postal address so that you can receive this book at your doorsteps. So there is a small request for all the PG students, since every time we will be having this prize, so be prepared with your questions and keep posting in the chat box, which I will be forwarding it to our respected speaker after the end of his delivery. So moving to the today's program, we have a wonderful speaker who will be sharing his expertise on how to make effective presentations. To introduce the speaker, may I call upon Isa Kaur Arora, a PGT from AIMS, Jodhpur, to introduce her. Isa, it's over to you.
Yes, sir. It's an honor to introduce today's speaker, Dr. Vihang Vahia, who has many accomplishments to his name, including that he is the International Distinguished Fellow of the American Psychiatric Association, Professor Emeritus of Psychiatry, Dr. R.N. Cooper Municipal General Hospital and HBT Medical College, Mumbai, founder HOD of Department of Psychological Medicine, Dr. R.N. Cooper Hospital, Mumbai, former Professor of Psychiatry, Cooper Hospitals and Save GS Medical College, Mumbai, consultant psychiatrist, Breach Candy, Leelavati and Messina Hospitals, Mumbai, member of the National Advisory Board, Indian Association of Private Psychiatry, former international membership committee of American Psychiatric Association, life fellow of the Indian Psychiatric Society, life fellow of the Association of Private Psychiatry, chairman of the CME committee IPS 2021 to 2022, former chairman CME committee of the Indian Psychiatric Society, former chairman CME committee of the Indian Association of Private Psychiatry, member of Positive Psychiatry Section, World Psychiatric Association, founder, managing trustee and CEO, Dr. N.S. Vahia Foundation, Mumbai, past secretary of Indian Psychiatric Society, and he has several publications in index journals, chapters in textbooks and monograms. We have a lot to learn from him today and in the times to come. I would like to now invite Dr. Vahia for his session.
Thank you, Dr. Isha. Well, that it is. Yeah, when you're about to be 71, you pick up a few things as you grow along. I indeed thank the IT section of postgraduate training and development for asking me to be here today. I've been given a very interesting topic. Let me get, yes. Been given this very interesting topic on how to make a presentation and how to utilize computer skills. It all boils down to this English idiom of those who can do, those who can't teach. And today I'm going to teach. To declare my conflict of interest, I have none. I'm not being paid for making this presentation. It's purely by invitation. And I indeed thank Dr. Shaul Amin and Dr. Sujit for arranging this and making sure that I don't miss out my appointment. And the tech backup team for all the making things go so smooth. Long ago, I came across this slide which says there is death by PowerPoint. And the message was that when you have to say something that is significant, it's important that how you say it makes it interesting, and how much you put across to the others is crucial. Your depth of knowledge is important, but being able to impart it to the others is more important. This gentleman who presented 263rd slide with half the audience being asleep doesn't make sense. So how do we make a presentation? There are three components of making a presentation. We have to prepare the presentation, which should have an opening, a body, and a summary. The opening is we tell them what we are going to tell them. Then you actually tell them what you want to tell them. And then you end your presentation by telling them what you have told them. Let there be no misunderstanding or miscommunication. And to make it effective, we have to have visual aids and slides, and we must practice our presentation before going on to the podium. So let's begin with preparing the presentation. Now, when we deliver a talk, we have to have a talk line. So here, for example, I've got these 4 talk lines. Now, when I start speaking, we should highlight it. This can be done by either changing the color of the font or change the font itself. But the audience should know what you're going to do. So we are going to talk now on preparing the presentation. How to prepare a presentation? It's not something very Herculean. The essentials of preparing a presentation are to know your topic and the relevance of the selected topic. Sometimes the speaker doesn't have the choice to select a topic. The speaker is allotted a topic. But the fact that the speaker has agreed, it becomes a selected topic of the theme of the meeting. Then the speaker should be sure of why is the speaker accepting this invite. What are the other topics of the meeting? Who are the participants? And then we have to know the source of the data on which the speaker proposes to make a presentation. This is the outline of your talk. That is another aspect of preparing for a talk, and that is the logistics. That's completely a matter of speaker's personal preference, which the organizers should be able to accept or reject. You have to be sure of how are you going to travel to the venue of the meeting, who's going to sponsor your travel, is there going to be a remuneration, are you going to be paid for the talk, or do you have to pay for giving the talk? Is there some kind of a remuneration in kind or status? And whatever the other factors. Having done that, we now move to the topic of the presentation. So when we say topic of the presentation, it could be an original research or an expertise by practice and teaching of the speaker, or it could be a topic of the speaker's interest or the speaker's passionate commitment. Next, we should know whether the talk is going to disseminate information or going to disseminate knowledge. So what's the difference between information and knowledge? A simple definition is knowledge is pre-digested information. Information is giving the data. Knowledge is interpreting the data in a manner which it makes sense to the audience on the topic of your presentation. The topic could be something that has been reviewed by the speaker several times. Some meetings are these masala mix meetings. 9 o'clock in the morning to 5 in the evening, 20 speakers, 20 topics, everybody talks for 20 minutes and 5 minutes of question answer. The audience can't keep a tab of the topics because there are masala mix. Somebody is talking of prepartum psychosis, somebody is talking of grief reaction, somebody is talking on COVID, one after the other without any link in between. It's a complete masala mix. And the worst is, somebody might come and tell you that, look here, we have a meeting, we have arranged a meeting, we don't find a speaker, so it might as well be you come and talk. It's one of those waste paper basket invites, which I don't particularly enjoy. Then we come to the relevance of the theme of the meeting. What is the reason? What is the occasion for which this event is being organized? Is it being organized by a society? Is it medical? Is it some other professional group or a social group? Students, or it's one of those random meetings? That doctors, paramedics, administrators, would it be open audience? Would that be professional? And why have you invited me? Is it because the subject is my liking? Is it because of my expertise, my past experience? Or am I one of those, I can't find a speaker, so you're a stopgap speaker? What is the time that you are going to give the talk? Is it going to be an early morning talk when the audience will be thin? Or is it a late evening talk when the audience will be thin? Is it a pre-meal talk of a conference where you have the largest audience? Is it the post-meal meeting where people will be half asleep? And is alcohol going to be served just before your talk or during your talk? Because if the alcohol gets served during your talk, half the audience is going to get up and prefer a drink to your talk, no matter how important the talk. Then where is this talk? Is the venue easy to approach? Is the accommodation comfortable? Is the travel easy? What day of the week will that be? Do I need to reach there the previous evening because the travel is very tortuous? Or can I come in the morning, deliver my talk and go back in the evening? Then you got to know what is the kind of audio visual that's going to be arranged. Will it be a laptop on my podium where I can read what I am speaking? Will there be a central server where I have to read the screen as I'm speaking? And who are the speakers before me? And who are going to be the speakers after me? Because your talk must match the general theme. The presentation must merge with the topics and the theme of the meeting. So and whatever you talk should be of interest. Then figure out what is the motivation for accepting the invite. Are you accepting it because it's an occupational profile? The president of IPS has got to talk, whether he likes the subject or he doesn't. Is it a corporate responsibility? If you are working for a company, does the company expect you to talk? Is it an academic requirement? Is it something that you are preparing for DNB and you are required to make presentation, or you are in an institution where your teacher insists that you must learn to share your knowledge with others? Are you presenting an original research data, or are you going to review a data researched by the others? Is it sharing a reviewed data, or is it sharing something that you have experienced, a particular patient or a particular event that you think is worth sharing, how a particular patient took a turn that you didn't expect? Well, you want to share it with your fellow colleagues, and that's when you would do it. You're sharing an experience. You might be participating in a peer group meeting, a postgraduate journal club, for example, on a topic of uncommon interest. Or you might be participating in a peer group meeting with a topic of common interest, preparing for an example. Are you going to be paid? This doesn't happen so much in India, but abroad, whenever you take even a grand round or when you make a presentation, you get paid for doing it. And then, what is the relevance of the topic in your professional field? Are you going to be saying something which helps in your professional field? Are you, for example, if you are going to be asked to talk on music and psychiatry, are you going to talk on how music helps patients of mental illness feel good or get better? Or are you going to talk the technicalities of music which not many people may understand, especially in a medical conference? Having done that, what is the sense of relevance? What is the incentive for accepting the illness? Is it has, for both the presenter and the participant? Does the topic have a purpose in their personal or professional life? Is it a pleasure to listen to someone who reinforces your ideas? Does it empower you to learn something from the meeting? I'm empowered now to use this particular therapy in my patients of, say, childhood abuse because this particular speaker told me, or meetings on POXO. I'm empowered now to deal with the medical legal aspects of my practice. Or is it a prestige? Is this some very good speaker sharing knowledge? And it's a pleasure. There are times, not so much in our IPS, but I've gone and attended meetings where a particular speaker is going to speak at 1 o'clock and the hall is full from 11:30. If you go at 12 o'clock, you have to be sitting on the ground because all the chairs are taken. Is it a prestige to attend this particular speaker's meeting? Does it give me prosperity? Prosperity may be financial or intellectual. Have I become a wiser or a richer person, not in money, but at least in my intellect, in my professional knowledge? Does this fit into my passion? When I went and attended a talk on RDoc, there was a passion. You wanted to know the difference between DSM and RDoc. So you went and attended the topic because you wanted to. It is a passion for learning. It's terrible when you are pressurized to attend a meeting. We had at GS Medical College, we had an international faculty coming in. The dean had invited him. And when the dean and the speaker went into the hall, there were only 15 people sitting in the hall. So the dean came and took all the postgraduate students from the library, forcing them to attend the lecture. This kind of pressure is not something that most of us would enjoy. Nobody likes to be pressurized to attend a talk or give a talk. Even worse is a punishment. The boss is talking, and if I don't go, probably my thesis won't get signed. So I better go to avoid a punishment. And sometimes it's petrifying. Some time ago, we had a president of our society. And anytime that particular president of our society was to talk before my talk, I had to sit because I had to be on the podium the moment the president came down the podium. And when the president was asked to give a 10-minute talk, the president would not come down anywhere between 30 to 40 minutes. I once sat through 70 minutes, reminding the president to stop the talk, but the president would not do that. So it's petrifying to attend that particular person's talk. These are not good ideas. We come to other topics of the meeting and the participants. We take that together. Remember, one size does not fit all. Every presentation has to be individualized for every participants. When you're giving same topic, say management of anxiety, to undergraduate students, postgraduate students, to Rotary and Lions Club and the IEMA of that small little city and the psychiatrists of that. If you're giving, this has happened to me, you get called to a smaller town and you're talking to the undergraduate students of psychology, the postgraduate student general medicine somewhere, the IEMA of the city, the Rotary or the Lions of the city, and then the psychiatrists of the city. So the same topic is being talked at 5 places or 6 places. You have to individualize every talk for every individual audience. One size does not fit all. And you have to take special care when you're making serial presentations. There have been events where I would travel with a speaker, 5 lectures in 7 days in 5 different cities. Well, the serial presentations must have individual rehearsals before every presentation. And especially so if you are going to use somebody else's talk or somebody else's slides. because every meeting has to be unique. You cannot be going and talking like a parrot. When you visit a city, try to incorporate something specific about that city in your talk on the first slide. Maybe a historic monument of the city, maybe the river flowing through the city. When you're talking in, say, Varanasi, you speak of the Ganges, or when you're going to Delhi, you speak of one of those monuments. So if you're going to talk in Agra, you always get a slide of the Taj Mahal in your introduction. Every meeting has to have a particular setting. And remember, do not ever compare. Don't tell the doctors in Hyderabad that people in Sikandarabad are so much better than you, or they ask me such interesting questions where you guys are dumb. Don't do something like that. Never ever compare the audiences. Then we come to the source of the presentation. When we come to the source of presentation, various things happen. You would be called, please pardon me, this is the closest that I ever got to George Bernard Shaw. And I'm going to, not exactly plagiarism, but I'm going to follow his advice. He said, I often quote myself because it adds spice to my conversation. And I'm going to do that. What are the options? A sponsor or the organizer would tell you that this is what you need to speak. I want to make sure that the speaker says this, full stop, you have no choice. You are like a parrot or a puppet of the organizer. Or the organizer would come and give you a set of slides and say, these are the slides that you read out. Or there are ready for reproduction slides. So they'll give you a set of slides and say, Doctor, is pe aap batao. I was once called at an international meeting, Royal College of Psychiatrists meeting held in India years ago. And there were 4 speakers. I was the 4th speaker, and all the speakers had the same set of slides given by the organizers. Fortunately for me, I don't accept that kind of talk, so I had prepared my own slides. But the first 3 speakers repeated the same set of 25 slides with minor variations. You would get into a terribly embarrassing situation if you don't have your own original slides. Don't ever get swayed by the slides prepared by the organizers and say, these are the slides, do your talking. I hate these situations. The next is, you would have probably a set of reference slides without the narrative. The organizer would say that, Doctor, some of the finer points that you may want to include in your, like some data or some analysis or some RCT done somewhere by this, that the sponsor is aware of, some meta-analysis that has just been published. And the organizer may say that, sir, you might not have had an opportunity to read it. So here's a slide, you may use them if you feel like. That works out well sometimes when you're doing a drug launch study. Some of the data is not in the open domain. The company might come and say that, sir, this is the data we have. You may use it if you feel like. The next, of course, the best is when the speaker can determine the contents and the presentation of the allotted topic. The organizer would say, this is the topic, this is the message we are trying to convey. But you give your talk. So for example, if a drug company says that we want to launch a drug and we want you to talk on this disorder, say we are launching a new bipolar drug and we want you to talk on bipolar disorder, then you would talk on the disorder, not on the drug in that disorder. Unless you have been specifically requested to introduce this particular drug in your presentation, doctor. Then your presentation is on the theme. Then when you come to management, you may say that these are the drawbacks and here the sponsors have a drug. And according to the sponsors, this is what they say. If you are a part of the PI or if you have done the stage 4 studies, you might share your experience. But it's your decision. You are not a parrot of the marketing department of the company that is organizing the meeting. And of course, the best is when it is a speaker initiated presentation. These two are the best kind of presentations you can make. Having said that, what are the speaker's personal preference and practice? That is the best possible option. The speaker has the freedom to decide what he wants to say or she wants to say within the framework of the allotted topic. You can't have a presentation or a conference running amok. So there is a framework which the organizers would have decided, and within that framework the speaker can say what the speaker wants to say. When you do that, be very sure of the message that you intend to convey and make that a very good carry home message. Now when you do that, there will be people who will approve of what you say and there will be people who will refute what you say. So if it's your initiated topic, you've got to be prepared for opposition and have ready answers to justify your talk. To do that, there has to be an extensive review of the data and information on the topic. It must be cited. You cannot present somebody else's data and say this is my data. That's plagiarism, which is criminal. And there are several journals which say that when you reproduce any part of the article from that journal, you must take up permission to reproduce. So make it a point that you have written to the editor of the book or the author of the article that you're going to reproduce this particular data in this particular phrase in your presentation. Never ever accept somebody else coming and giving you a sort of slide and say, "Ye meri slide hai, aap pad lo." Don't do that. That takes away your originality and your tone. And when you make a presentation, be prepared for an interaction. So when there's a presentation by the speaker's choice, decide the message that you want to convey. Be sure of what you want to tell them. Then go backwards. If you are going to say, for example, speak on new classification of catatonia, then you'd go back and say that for 3 decades, catatonia meant schizophrenia. But the recent, last 5 years, since 2013, the orientation has changed. We now don't look upon catatonia as schizophrenia, we look upon catatonia in other conditions. So you would have said, why was catatonia called schizophrenia? Why has it changed and what is the current status? You must go backward and give the development to your current theme in a quick 1 slide or 2 slides. And then eventually clarify the topic in your carry home message. Then identify the theme and the trend of change of, say, diagnosis, how the diagnosis of catatonia changed from schizophrenia to other conditions now in DSM-5, for example. Then don't give too many details. Giving too many minor details doesn't help. You must keep it simple. I prefer to prepare my slides as I prepare down my topic. I prepare my slides as I'm preparing my talk so that it's easier to maintain a link. And there are countless rehearsals. This topic on how to make a presentation between Dr. Vatve and I, we have made about 120 times this presentation, 130 times. But yet, I was rehearsing this presentation till about 5:30. So there should be countless rehearsals. And be vigilant about the visual appeal of your slides. Whenever you prepare your slides, see them for yourself and repeat your talk to yourself and ask yourself, will I sit through somebody else making this kind of presentation? No, then don't do it. Because the audience has to feel involved in what you're talking. If the audience cannot comment or cannot connect with what you say, it doesn't help. And the acronym is KISS, your presentation. So what is KISS, your presentation? Nothing erotic about it. Keep it simple, stupid. Keep your presentation simple, not complex. A good presenter simplifies a complex topic and a bad presenter complicates a simple topic. Remember that. Then we come to the summary. At the end of your talk, you must tell them what you have already told them. Make sure that there is a synchronization of what you say. Any professional person can be an effective presenter. Knowledge is not enough. You got to be able to communicate it well. The others must understand what you have told them. And then when you make this summary and all the effort, it's always a rewarding presentation. We now come to visual aids and visual slides. So there are some tips of making decent presentation. The appearance of your slides. I got this article in 2015 It's an article that I downloaded in 2015, which says how to prepare and deliver a presentation. So a good presentation must educate and inform. Even if it is reinforcing or revising the old data, it should still be educative because nobody remembers 100%. जैसे ये तो मैं भूल ही गया था, अच्छा हुआ मैंने ये सुना. It's educated me. It should inspire interest, or it should be so motivating for someone to mimic the data that you have discussed. Read up what you have presented, or even conduct the study that you have presented. It's important to replicate your presentations. Sometimes this has happened to me that I made a presentation and somebody took my slide, and the next presentation that speaker was before me and he presented my own slides as my preceding slide, and it became a bit embarrassing. But then in a way I was happy that my presentation made that speaker repeat it. It was important that the person repeated my imitation is some kind of a flattery. If somebody imitates your studies, somebody imitates your data, somebody imitates your way of talk, somebody imitates your slide of presentation, that is a flattery. Take it. And every presentation should be entertaining. You don't want the audience to go leave your hall crying. You want the audience to leave your hall smiling. Good, I attended. That kind of a feeling. Because a good presentation will always grab and hold the attention of the participants. Visualization reinforces the presentation. That's a rule of the thumb. A good visualizing is always an addition to your presentation. There is data to say that audience retains more when they both hear and see as compared to just hearing or just seeing. We see these politicians making speech and we hear them and don't remember. Sometimes those politicians, there's, we only see the background, or we only see something that somebody else is narrating. But when we actually see and hear simultaneously, it gets into our head very strongly. A whole lot of TV news channels do this. They make you see things as they're telling you things. So what is the prerequisite of a good appearance? You have to know your subject. Within 3 minutes, you will know whether the presenter is talking sense or nonsense. The first 3 sentences of your topic will carry the strength of your presentation. So know your subject, know what the people are looking for. The first 3 sentences, the audience must connect with you, or if it is disconnected, it will never come back to your presentation. Then you have to develop a theme. Catatonia was always schizophrenia, then DSM, very often we found that catatonia responded to say lorazepam, we didn't even have to give an antipsychotic. So there has been rethinking, and now in the DSM-3, DSM-5 of 2013, the whole concept of catatonia is revised to say whatever. Even DSM-4 had partially revised, DSM-5 did it very well. So you want to say that the theme as how it kind of developed. And what are the key points? Why did DSM-5 differ from DSM-4 in its classification of catatonia? It's given in the large book of the DSM-5. Or definition of personality disorders. We always considered personality disorders as dustbin diagnosis, but DSM-5 section 3 looks upon personality disorder as different dimensions of personality. Why did it so well discussed in the book itself? So develop the theme, list your key points, and illustrate your key points. Give examples. Even if it is not visual, give actual examples. And don't ever give your own personal example, but give examples, speak in third person, illustrate your point. At the most, you should spend 1 minute per slide and not more than 4 or 5 points at the most in a 45-minute presentation. Albert Einstein said, if you can't explain it in simply, then you have not understood it at all. A good speaker simplifies a complex topic, whereas a bad speaker complicates a simple topic. So always make sure that your presentation is simple to understand. So when you're making, say, a PowerPoint presentation, you can use keynote, video clips, pictures, x-rays. When you use a PowerPoint presentation, you have to be focused on the background, the contents, the fonts, the sequencing of slides, timing, and animations. I'm going to discuss each one of them differently. When you put text in your slide, please put them as bullets. It need not be complete sentences. Put them as bullets and don't turn around to read your slide. Most of the time, when you are making a presentation in medical meetings, the audience can also read English like you can read English. So let them read the slide themselves. You don't turn around and read the slide. The risk is that if the presentation is not interesting, when you look around to read the slide, when you turn back to the audience might have withered away. So only put text. Do not read the slide. Highlight the points to be stressed. We said some people, some words in red I had put in my slide so far. To highlight, you can change either the font size, font type, or the color of the font. Now the contents of the slide should be in slides font size 24, 28 and titles in 32. 28 is too big, like this one is 28, this particular slide. It's too big. When you're making few points in bullet, you can get away with it. But if the slide has more contents, then size 24, font size 24 is important. Title in bigger fonts and maybe in different colors. Select proper color of the slide. If you have a colorful background, some colors the letters will not fit. You'll have to be very, very cautious of the background of your slide, because otherwise the color of the fonts, the content of the letters will get messed up. Or if you have a very colorful background, but the font colors will be a problem. Again, a colorful background, but you got to be very, very watchful of the fonts that you use. Very nice background, but the fonts will be a problem. So if you use a light background, use dark fonts. And if you use a dark background, use lighter fonts for your words. Having said this, we go back to the appearance. So what are the fonts? There is something called serif font, sans serif font, and special font. So what's a serif? You have seen this. These little lines at the beginning and the end of the letter are called the serif. Serif fonts are good for the title, but not for the contents of the slide. So what are the serif fonts on the computer? On everybody's computer, the font Times New Roman, American, or Ember type. There are these little lines at the end or the beginning of the letter. So these are the serif fonts. Then there are sans serif fonts, which don't have those lines. They are, just one line. They make good component, or any content of your slide should be in sans serif fonts. Within the content of the slide, if you want to highlight something, you could use a special font like Agatha, Bradley, Old English, or Samarkand. These are nice fonts for just one word in your content of the slide or the title of the slide. You can't have a whole slide in these special fonts. That's not good for the eye. The eyes get strained. Even if you use serif font in the content of your slide, the text of your slide, it's harsh on the eyes of the readers. For the readers, it's easier to read sans serif fonts, even from a distance. So the title might be in a serif font, but the contents of the slide should be in a sans serif font, because that makes it easy for the person to read. You would realize that the thickness of the letters varies. For example, the E. This line is thinner than the rest of the line. Or for it's not so much in this one, but in Times, when you start writing the upper lower font, these kind of changes become very, very apparent. Whereas in a sans serif font, they are of the same thickness all along. So this is easy to read for the participants, as opposed to a serif font which is not easy to read from a longer distance. Then the color. Choose different colors for the text and the slide. If you have a white or a light yellow or a light gray or a light green background or even light pink background, strong dark colors. Don't use bold letters. They don't come out easy on reading. They look good when you are preparing the slide. They don't look good when you project a slide. So don't use bold fonts. Use regular fonts. You might use italics to emphasize a point. You might underline it or change the color. Or one particular word might be in a different font of a larger size or a different type. But otherwise, have the slides, the content in one color and the title in a different color. The usual size can vary from 10 to 36. When you are citing at the bottom the reference, it's usually 11 or 12 depending upon the length of the sentence, and it's usually in a slightly different light blue color or something. But otherwise, very big letters don't always mean good slide. When you use animation, now I don't know whether it's going to come off in this slide, but use your animations to appeal and emphasize, but don't distract. For example, you don't want a slide that suddenly gives this kind of sounds. It might jolt people. Use your, you don't want to use this sound effect in your regular medical presentation. It's okay for a fun presentation, but not in a serious presentation. Then how many numbers and columns? Broadly, I would say avoid crowding. So not more than about 10 lines in a slide and not more than 7 or 8 words in one sentence if you are using the standard appearance of the slide. I'll show you, if time permits, something called widescreen. But in a standard screen, 10 lines and about 7 at max 8 words, depending upon if they are big words, only 5 or 6. But they are average size words, then 7 or 8 words in one line. That is easier for a person to read without seeing a very complex slide. And then change color. You can highlight the effect and use brackets when you want to. Then how do you deliver? When you go to give a talk, find out beforehand whether you are going to use your laptop on the podium so that you can read your slide as you are making your presentation. And when you keep the slide in front, you can look at the audience over the screen. So this is a good thing. If you have it on the podium, you are seeing your screen and you are seeing people behind the screen. Sometimes there's a central server. So you would be given, you have to give all the slides away to the central server. There's a keyboard on your podium and you press the keyboard and the server changes the slide. Sometimes there's a remote operation where you have given the slides, you are only given a little bit of, small little mobile phone like gadget, and you have to press forward, backward. That's about it you can do. And then there's a pointer at the end. So you can use that little gadget like a TV remote and you do the remote operation. And then there is this operator managed presentation. Next slide, please. Next slide, please. Next slide, please kind of presentation. Be sure of the projector. Make sure that it syncs with your laptop. Even if you are using a standard laptop, go a little before the presentation, go the previous evening if you have to. Make sure that your laptop syncs with the projector of that particular hall. A tabletop projector which is kept on a desk and projects on the screen behind you is one kind. There are these roof mounted projectors. If there's a tabletop projector and if you want to kind of point something, you can point your finger in the light beam that's going across and the shadow of a finger and use the pointer. Then there are roof mounted projectors where you can't do all this. And you got to be sure of the brightness and the colors of the projector. There's a setting that has to be done, and do it for your projection if you need to. Look at the screen. Is it a single screen or there are multiple screens? Is it a single screen behind you or it's a single screen on the side?
Should we give him a code?
Yeah, that will be better.
I spoke to him. He will log in again soon. Sir had some difficulty logging back in. I have sent him the link also. So he said he changed the company through which he is trying to log in even after that. Yeah, he has
Sir
logged.
is here. Sir is here. Welcome back, sir.
Am I audible?
Yes, sir.
All right.
You
So
are.
let me go back to my screen, and I'm sorry about this. I don't know what happened. Okay, are the slides visible?
Yes, sir.
All right. So let me see where was I when I left off. I'm sorry for this. Something that I didn't anticipate. All
It's
right.
okay, sir. That happens. Last time also it happened.
Oh, it did?
Not in our hands.
So this is where we were. No, we were on the previous slide. So when, okay, we come down to the mic, whether it's a collar mic or a podium mic or a handheld mic. So if it's a handheld mic, it should be at least 4 inches from the source of sound, which is usually the mouth. So keep it 4 inches, otherwise there'll be a echo. If it's a podium mic, make sure that it doesn't obstruct your view. And if it's a collar mic, it should be worn about 4 inches from the mouth. And people who are wearing saris, for example, or any other multiple, for tie, the mic should be in front of the sari or the tie. Otherwise, it will keep rubbing and make a very peculiar sound, which is not always very pleasant. When you have a pointer, and if it's a stick like this, hold it in your hand. Some people tend to hold it on, like a weapon. Don't do that. Hold it in your hand or keep it away. If it's a laser pointer, make sure that you have made sure of the brightness, which button to press, and release the button when you don't want the pointer. You should not be pointing the laser at the audience. There should be slide with changers, in which case you got to be very careful of where it goes, backwards and forwards. The brightness and the laptop cursor, you should be under your control, and you should know exactly what you want pointed at what point in time. Be sure of where is your chairman's table, the distance between you and your chairman's table, the location and the direction, and the mics on the chairman's table and in the audience. Keep drinking water handy, and don't keep it on the podium, otherwise it might spill over on your computer keyboard. So have enough tissues to wipe your own sweat or whatever, and make sure that the room temperature is known to you. Otherwise, like I did now, carry a little towel to wipe your sweat. Let me go back to the previous slide, which I think I missed. We were here on this slide when the connections went off. So the screen and the light and the focus. Now the light should be on the speaker, but not in the speaker's eyes. So sometimes you have to make sure that to make you look handsome or beautiful, the audio, the arrangement, the housekeeper, the keeper of the hall might focus too much of light on you, which blinds the speaker. Don't allow that to happen. And there should be no light falling on the screen. Otherwise the projection becomes hazy. And about should there be a light in the hall when you are talking or not is speaker's choice. I don't like my audience to go to sleep when I'm talking. So I like that there is light in the audience as much. At least some people will feel a little ashamed and not sleep when you don't want them to sleep. Now there are some rules for making a presentation. The golden rules. Why did I change the color of the background? At some point in time, I said that if you are making too many points, you must compartmentalize your slide. So to compartmentalize my slide, I have used different font colors. This is a long presentation, so I've used it. Golden rule is, do not turn around when you are reading the slide. Always face the participants. We usually look good in our front. Very few of us look good on our back. So let the audience see the best part of you and not your back. Do not have too much slides. Compartmentalize your talk. Avoid details. Please avoid details because they won't be remembered anyway. Then there is mechanics of presentation. So you might use MS PowerPoint, which is the easiest. But you should look good. Not just the slide, you should yourself look good. So comb your hair and wear proper. Don't kind of appear as if you just got out of the bed. You can use text point, latex PowerPoint for your formulas. Have a few jokes, but have the jokes rehearsed. When you're cracking a joke in the audience, the joke should be rehearsed. It should look like a spontaneous presentation, but it should be a rehearsed spontaneity. You should be very, very careful of how you are making a presentation, how you are going to speak the joke at a point in time. I remember there was a speaker who was not so much pro psychiatrists, and he wanted to make a kind of pun on mental hospitals. So you must have heard this joke about a psychotic patient when a nurse went to feed him, grabbed the nurse, raped her, took away her keys, and left the mental hospital. So the joke was nut, screws, and bolts. But the speaker messed it up. He had not rehearsed this. So he said, mental hospital, a nurse went to feed a patient. I don't know why the nurse had to feed the patient, but patient should eat himself. He's mad. He is not lunatic. He is not paralytic. But yet the nurse went to feed the patient, and the patient, he did what to the nurse? I don't want to mention what he did to the nurse, but anyway, he ran away. And then, what the paper said? He said, nuts, jokes, bolts, and bolts. No, sorry, what did he say? He said, nut, screws, and bolts. Oh, I forget. But anyway, it was very funny. Well, don't let that happen. The joke that you want to say must be properly rehearsed. Even though it might appear spontaneous, it should be rehearsed. And if you are not good at jokes, don't tell jokes. You don't have to speak a joke or tell a joke in a presentation. And the more you rehearse the talk, the better will the talk be. At least 5 rehearsals before a talk. Even when it is a talk line given properly, try and repeat the talk line during your presentation. There should be uniformity of details from one side to the other in the form of color coding and the fonts. Repeat a message. If there is some message that you want to give, say a personality disorder, relations within the family, repeat that content 4 or 5 times during your presentation. The talk should be sequential, not too many carry home points, and don't plunge into the detail. So there are this is from Boston University, oral presentation techniques. Keep it simple, use few words, at least 24 size font in your text, 22 sometimes, but at least 24. If the audience is small, you can use 22. List your talk time and the key points. Please be sure of your phrasing, use proper color, and handouts if it's an important material which you want to people take it home. Don't ever read your slides. There are these Kent universities on making presentation. This is going to come to you in the slides that I'm going to hand over to the committee for distribution. But remember, please dress smartly. Try to be relaxed and appear smiley even though it is normal to be nervous. Say hello and speak very clearly. Your words should be at the rate of 80 words a minute. Don't speak too fast. People will not be able to keep abreast of what you're trying to say. They'll not be able to link up with you. So 80 words a minute. And if you have said something important, pause. Let whatever that you have said be absorbed by the audience. It's important to know when to keep silent so that the audience can reverberate your words and absorb your important message. Try to speak to people. Keep within the allotted time. I was given 1 hour, maybe I spent 5 minutes, so I'm going to take 5 minutes extra. Be lively. Don't stand like a statue. You're a human being and be human. Some people even like to walk around, but that's a little odd sometimes. Involve the audience. Sometimes ask a question and get a feedback. Be very well practiced. Wear a watch so you know your time. And never mind if you are going to be a little nervous. It's important again to know the computer and the lighting of the hall. When you're talking and if the slides are behind you, then stand on one side. Please remember that the slides are not a security cover for the speaker. So the slide should not fall on the speaker. Step aside so that the slides are on the wall or the screen behind you and the audience can read your slide. Do not use too many slides. Do not write too much on one slide, of course. Use them as a prompt or a reminder for you to continue your talk. And I can't demonstrate this to you, but when you are projecting a slide, and if you want to make a point, you want to elaborate on a point that has gone in a slide, if you if you type the B on the key B on your screen, the screen will go black. Again, strike the B, it will come back. Or if you press the letter W, it will go white. And when you press it again, it will come back. So use W or B to make your screen blank white or blank black when you want to say something between the slides to carry home your point with emphasis. Use sans serif fonts, use color bold emphasis. I have said, we have discussed this. Little bit of humor helps. Do not get swayed by the PowerPoint effects of dishum. Use it to your advantage. Do not, you're not there for some comic presentation. You usually make a serious presentation. Use your charts because they are important. Charts take away the monotony of presentation. But use your graphs or pictures or charts only when they make sense, and don't use them just because it's a nice picture. Use it because it makes the point stronger. We come to I think somewhere down the line I missed one point. Anyway, let me make sure something got lost in my presentation. What I wanted to say at some point in time before the slides is this. I think the summary, the importance of summarizing your slide. This somehow got missed. It's important at the end of the topic to summarize your presentation. And in summary, when you say, remember, any professional can be an effective presenter. Knowledge is not enough. What you know is important, but what the others understand in what you say is more important. And having given a proper summary, having focused on the appearance, we come to the last bit of my presentation, the last actually 2 or 3 slides of my presentation, which is the importance of rehearsals. Please practice your delivery. Mark Twain said that it usually takes 3 weeks to prepare a good impromptu speech. Even when you are being asked to say something in a meeting or you are at a dinner and somebody, you know that you are likely to be asked to make a speech. So prepare it beforehand, even though it's just a spontaneous, rehearsed spontaneity. You have to rehearse what will appear to be a spontaneously prepared speech. And my last few slides, the carry home message, my friends, ladies, gentlemen, is that if you have to say something that you believe is worth sharing, then the least that you can do is to make sure that you say it well. Ladies and gentlemen, I have overshot my time by at least 4 minutes. Thank you very much. With the permission of the chair, can I make one point that I wanted to make to the there is something called page setup. Now I'm going to demonstrate. When you do a page setup, if you go to the file, and there is something called the page setup. And when you go into the page setup, what I have done is on screen 4:3 proportion. You can make the wide screen presentation, in which case the screen goes wide. Now when you do that, your entire the composing of the slide goes haywire. If you have a slide which you have prepared, this part of the slide was prepared on a standard presentation. Now when it made it wide, this is what happened. So when you make a slide and then if you don't like it, you can't go back. When you go back and say, for example, this you don't want to store, but even then you say, no, don't save. But even, let me demonstrate this to you slightly differently. Even when
Sir,
you don't,
sir, please share the screen, sir. Your slides are not visible, sir.
I will. Okay. Share my screen. Okay. Now it's visible.
Yes, sir.
Yes, sir. Yes, sir.
All right. Now what I wanted to show, see this slide. Declaration of conflict. This is a slide that is prepared on standard presentation. Or for example, see the next slide. This is prepared, this was my first slide before I got the new, right? This is the way it would look. The sides are black and only a part, only the visible part is lit. The background is black. Even on the previous slide, the slide that is visible is different from the total screen. Now, when you want to do it differently, what you can do is what is called page setup. Now, page setup, I'm going to show. This is Sleet. Can you see it?
Yes, sir. Yes, yes.
So when you want to do this presentation and change the slide, you go up to the file, go up to page setup, and then what you do is you either keep the same setup, then you don't even have to go up there. But if, oh my God, now what's happening? Okay, you go up to the file, you go up to page setup, and then you ask for a wide screen. When you ask for a wide screen, the screen becomes big. All right, the screen size has become bigger. The sides on the black, the poles on the sides have gone away. It has occupied your whole screen, but you will have to recompose the slide. The part of the text has now gone on to one slide. So you'll have to recompose the slide when you use a wide screen. So my advice is, this is, the screen became white, so what was black has now become white, and it takes away the presentation impact. So if you decide to use a wide screen, then even make your slides in the wide screen presentation. Ladies and gentlemen, thank you very much. I would take questions if any, but there shouldn't be much, I would guess.
Thank you, sir, for the excellent presentation. There are a few questions asked by the PGTs. I will be forwarding them. I will be reading them out for you, sir. The first question is by Dr. V.V. Anupama from Kanpur. She has asked, in case we are doing a study on school students, where we need to collect data, do we include the information regarding the questionnaire as well, or just a brief introduction to the topic before we hand over the questionnaire to them? How to make such presentations effective?
So you want to say whether you should demonstrate the questionnaires to the students? Well, at least a few specimen questions should be demonstrated. The student should know what they have to answer or how do they have to answer. So if you have a questionnaire of just 10 questions, you might put all the 10 on the screen. But if it's a long questionnaire, some sample questions should be presented to the students before they are given the questionnaire to fill up.
Thank you, sir. Next question. Next question is by Dr. Uma Hani. How to manage time during presentation?
Sorry?
do
How
uh,
to?
to not fall short of time? How to manage time during presentation?
You have to rehearse it ahead of time. You have to be very, very sure that you stick to the time. Your present should be a Nobel presentation. Every good presentation is a Nobel presentation. Nobel presentation. Make sure that
Yes,
in
sir.
your presentation, the chairman doesn't have to keep ringing the bell to ask you to stop speaking. All good presentations should be Nobel presentations. And that's rehearsal. You got to decide, you got to figure out what is important, what is it that you want to say. If it's a 10-minute presentation, not more than 2 points. If it's a half-hour presentation, not more than 3 points. If it's a 45 minutes, you can have 4 points. If it's 60 minutes, you can have more than 4 points. And decide, you have to set the hierarchy for yourself.
Yes, sir. The next question is by Carolina from Christian Medical College, Vellore. She has asked, how can we make a theoretical presentation like theory of mind, psychodynamic, school interesting? I understand about making it with simple explanation and picture, which will make them understand. But is there anything else, sir?
It's a question of communication skill. When you're making a theory presentation, your communication skill is important. I have sat through my teachers who would speak for an hour continuous without any slides, and every word that they spoke was remembered by the students, because when they were making a presentation on a point in theory, they would repeat the important point several times so the students could take down the notes. There were some teachers who would say, write down this point, please, because that's a point which is of relevance. So it's a question of individual skill. Remember, the slides or the presentation is only an aid for you to make your point. It doesn't make a point by itself. It helps you to make sure that what you want to speak is understood by the others. Slide making is only an aid to presentation. It's not a presentation by itself. It doesn't carry the topic. You have to carry the topic.
Thank you, sir. Next question is from Hansini from Vihang. She has wrote a small question, sir. How do these dynamics of presentation change in post-COVID era of online webinars and presentations?
Online webinars are of different kinds. They are very, very different kind webinars. There are some webinars I have done few for the corporate sectors where people want to just ask questions. Or there are times when you go on to a webinar, people just want to be heard. And there are sometimes the webinars, people just want to express their opinions. So if you are then in a faculty position, you just respond to what is being asked of you or thrown at you. There are some times when at a webinar, the organizers would say you give an introductory talk. Then you ask the organizers what are they expecting from that talk. Nobody in this COVID era wants to be told about what is a coronavirus, and they only want to know how to save ourselves from corona, or now that we have had corona, how to protect ourselves from any further damage because of corona. They want pointed advice. So be very clear of what are they looking for and give them that advice only. In this corona time, COVID time, the most painful cases that I have faced, where sometimes I have found myself speechless, is when I have to deal with a person in grief. What has happened in corona lockdown is that the habitual grief relieving mechanisms haven't occurred. The social rituals of grief relieving haven't occurred. So a lot of the families have not been able to bring the grief to a closure. And these are the families that they understand, but they can't come to terms with themselves. And they are the ones who need to be reassured that what they have done is appropriate and nobody else could have done it any differently. So in COVID time, you can't prepare slides because you are responding to questions and you don't have questions beforehand. So you have to have your strategy that if somebody is going to ask you a question on how to look after myself, you're going to give them this set of advice. If there's somebody is asking you, how do I look after my children, you're going to give them a different kind of advice. If there are people who are going to say, how do I deal with my own fear of COVID, you're going to give them a standard advice. If somebody says, I've had COVID, I've recovered, and this is my residual symptoms, or no residual symptoms and my scare, well, you know what exactly what you're going to tell them. The most difficult that I find is dealing with people who are not able to come to terms with a demise of their, survivor's guilt and things, that segment of psychological stress post COVID. That's really difficult to deal with. Again, my only solution is I listen to them. I sometimes spend, if somebody calls me on a
Thank you.
company webinar, then I give them my address. I ask them to make a separate WhatsApp call to me. And then all that I do is just listen to them. And after listening to them for 45, 50 minutes, sometimes I would say, okay, what would you like from me? And standard answer is, doctor, no, just thank you for listening. Talking to you has made me feel good. Can I call you again? If you say, do you need an antidepressant? They would say, can I wait for 2 weeks before I take an antidepressant? People are not very keen to take antidepressants or any other medicine. Melatonin, sometimes you can persuade them to take, but people who in post-COVID are not willing to take medicines. Even people in pre-COVID or people who have not had COVID do not want to take medicine. It's only a communication skill, and the best mechanism I found is only listen to them. Just listen to them. If somebody has had bad experience at the hospital, don't try to defend the doctor or the system. Just listen to them. At the end of the talk, they themselves would say, doctor, I'm sorry, I was emotional. I said bad things about so and so. I don't mean to, but I'm glad I got an opportunity to ventilate myself. I think that is the role that I have played in several cases. And sometimes I have got back a feedback saying, thank you very much, doctor. Somebody would have said, doctor, I talked to you about my post-COVID, but then, I also have a cousin. Can you speak to that cousin? That kind of calls I get often enough. Next question, if any.
Yes, sir. This question is from Abhishek Kumar. Yes, wrote, respected sir, I have a doubt regarding presentation. How to cope with anxiety during presentation?
It's important to be anxious during presentation. Anxiety is not abnormal. The way you respond to your anxiety is abnormal. When you are anxious, you are running on adrenaline. So when you are anxious, your attention is going to be good if you are focused. It depends upon how you talk to yourself before you go for a. I get anxious at every presentation, including today's. So what do? I have a piece of chocolate or a glass of water, or there's a bigger audience, I even go and take a paracetamol. I don't take a benzodiazepine. And I speak. I am anxious before the talk starts. So when I've well rehearsed, my first 1 or 2 slides go mechanically because I've rehearsed it so often that even as I'm struggling with my own anxiety, with my rote learning of my own 2 slides, the trend gets set. And once the trend is set, the anxiety vanishes. Anxiety is essential. If you're not anxious before you go to make a presentation, something's wrong. You've got to be anxious, but how you respond to your anxiety is what matters. When you get anxious, you say, okay, I'm anxious, I'm going to take care of myself. You're okay. And you say, oh my God, I'm anxious. Oh Lord, I'm anxious. Don't convert that anxiety into panic. It's good to be anxious. Don't panic. And you will not panic because you would have rehearsed. And remember, when you go to speak, auditorium. So have that sense of pride and confidence that I'm the only guy who knows all that I'm going to talk. Okay?
Yes, sir.
Yeah.
This is again a question by Dr. V.V. Anupama. Sir, often I have observed in the conferences that ink blue background is used and it makes it very difficult to focus. Any shape background color we can use for all kinds of presentations, especially for paper presentation PPTs.
So blue background, say depends upon what color, what shade of blue background. If it's a dark blue background, almost nearing a black background, and the font color is white, and the font size is 22 or 24, in a small hall 22, in a big hall 24, that's perfectly all right. Yellow letters,
Yes, and next.
as the title come off well on a dark blue background. But if it's dark blue background, don't use red or pink, only white and yellow. That works well. If it's a light blue, of course you can use black or dark blue.
Thank you, sir. This is a
You want me to demonstrate this blue background slide? I'll do it for you.
Yes.
I'll exactly do that for you. Just a minute. Give me a minute. Okay, can you see the slide? Are the slides visible? Hello, is the slide visible?
No, sir.
No? Okay. Let me. Is it visible? Is my slide visible?
Yes, sir. Yes.
Right. Okay.
Yes.
Now okay.
Yes.
So I've gone into this, and I go into the home slide, design ideas, generating design idea. Okay, where is the blue background gone? The layout, the insert. Okay, this is demo slide. Now I decide my font size. So let's say 34, 32. I want the entire to be 32. So I get the whole slide to be say 32. Okay. Having gone here, we look at the design slide. So generating design ideas. So you say take this background. All right. And here is my letter, which is white letters on a blue background. Comes off pretty well. So let's take this. It's a blue background, completely blue background with white and yellow letters. Right? It's white and yellow letters. And it is coming off pretty good. Here, this slide, I can change the font color and make it say yellow. It'll make it not this yellow, make it fluorescent yellow. It'll look good. It'll look good on the same slide. I show it to you. All right. But if I were to make the, oh no, not this. Okay. Now on this, if I say take, it won't look good. When I make it big, it won't look good. It looks a little dull. And I can make it worse by taking a darker shade. That from a distance will not be read at all. Sorry. From a distance, no, again, this is not the one that I am trying to show. Where did it go? Yes. Again, you take another, say, green. This is not as good as taking this blue. This is a blue on blue. It looks good. You can then do something else to it. You can take the same, this is a demo slide. You go here on, you go on, sorry. You go on to shape the format. So when you go on to the shape format, you can change the color slide. So I'll change the format. And this is the way it will look. Then I can change the color of the letter. And then I can change the fill of the color, and I make it this, or I can make it green, or I can make it just white, and then I've kept the outline is red. I can have no outline, or I can have outline as blue, or I can have outline as dark blue. And then I go here onto the effects and say give it a shadow. So I can give it a shadow which goes down, okay, and then I can then I can go and give the shadow a color. So options on the shadow, and then you have a color. So you can decide what is the color of the shadow you want to give. Say on a blue background you want to give an orange shadow, so you're given an orange shadow. And then you don't want it transparent, you can have less transparent, and that's the way it would look. So you can play around with your slide and give different effects to each font on the slide. So this, by going into the this shape the format, we have given the same thing a very different appearance. So this is a demo slide. What we had done otherwise, the same text was on a different style. This is a demo slide. Now, so we go and give it a larger font size, and then we give it a different color. So we can give it a monochromatic, just one size, and then you change the body, you change the font on the slide, you say Comic Sans, and this is the way it would look. And then you can make it bold, and that's the way it would look. Or you don't take it bold, this doesn't, you can make it italic, or you can go and give a underline. So there's so many variants based on what you want to project, how you want to project this. Let's say come here, shape the format, and you can also give it a shadow, or you can give it a reflection. All right, so when you say reflect, you give this kind, and now see what has happened. You've given your slide a reflection. So there are a whole lot of variants that you can use on making the title or putting the title on your slide. Even the animations, you kind of shift from one slide to the other. When you go to these transitions, you can give different kind of transitions from one slide to the other. So let's give 5 different transitions. This slide you give switch. This slide you give clock, and then see how it goes. Every slide the transition changes. There's a clock that came up, then you can have a wave coming up, or you can have a honeycomb coming up. You can have this I forget the name for this transition, but the point is you can go into the transition and have a little variety to your presentation, so it takes away the monotony of presentation. It can dissolve, the whole lot is available. You can have random bars, you can push your slide from one to the other. You can do so many things to make your slide presentation novel experience for yourself as well as for somebody else. And that's the fun of making presentations. Are the points clear? Any more questions?
Yes, sir. There are 3 questions. So one is, this is from Surabhi Surendan in the current scenario. Yeah. In the current scenario, as the presentations are online, what would be the important points to keep the audience attentive?
That's your individual talent. There is no standard off-the-shelf formula. That's your individual talent. But don't make it too long. It should be half an hour, not more, as far as possible. Unless it's a postgraduate teacher or a learning session. But otherwise, half an hour is at max is good. Or then you have to compartmentalize it and crack some jokes, give some time in between.
This is from Bharsa, Sims RC Bangalore. Sir, actually with the unbelievable ignorance towards psychiatry, let alone general public, medical fraternity is equally bad. How would we say we can present to healthcare staff about the fields and knowledge of psychiatry?
That depends upon your network. If you have good network amongst non-psychiatrists, let them invite you for a brief presentation. It might be a 5-minute or a 10-minute presentation. Or else attend a meeting, let the speaker present whatever, a CCF or even a paralysis. Then you raise a question of psychiatric aspect of that particular disorder. And say that from the point of view of a psychiatrist, this happens in COVID. When there are discussions going on, and then you say, okay, there is data that fluoxamine might be a good drug in patients of COVID because besides lifting the depression, it also lifts, it's also an anti-inflammatory action which is now proved, and it's appeared in the Lancet recently. The Lancet is planning a study on the efficacy of fluoxamine as an add-on treatment in COVID, especially when their own drugs like remdesivir has not provided the required relief or unanimity of opinion. Use of fluoxamine help, and then you bet sure you'll help, and that's how you make sure you kind of popularize psychiatry amongst the ignorant non-psychiatrists.
Sir, this is probably the last question. Is it essential to create some backup slides containing additional information like charts and data to answer audience? If time permits, and
I'll again show you what I have. Let me show you what I have. Share the screen. What's happened now? So this was my presentation today. Okay, I began with this slide and I ended with this slide, and these are the number of backup slides I have for this presentation. Okay, so out of these all the slides, sorry,
the second part was, if time permits and no one asks them, can such slides be presented?
Should not be. If nobody has asked you, that means nobody is interested. Then don't go and present your slides. Don't say, okay, you are a captive audience. Now there, I'm going to show my slides whether you want it or not. Don't do that. Gracefully accept that people are not interested and walk away.
Thank you, sir. I have not seen any other question in the chat box.
Thank you.
Okay, sir. I think it's 8:34.
Thank you.
So I'd like to thank sir for your excellent presentation, and it was really enlightening, and we all are benefited.
Thank you.
I would like to thank all the members who are present, especially the PGTs, without whom this program would not have been successful. And people from Torrent also deserves a special thanks because of their technical support. Thank you all. Goodbye until we meet again on next Tuesday. Thank you all. Thank you.
Thank you very much, sir. Thank